Sexual and reproductive health is a fundamental human right as well as human development issue that states must strive to fulfill. This right is guaranteed in various international and regional human rights instruments as well as national laws and policies. Kenya is a state party to various international and regional human rights instruments that has guaranteed the right to sexual and reproductive health. Furthermore, the Constitution of Kenya 2010 for the first time guaranteed the right to health care including reproductive health. It further provided that no one should be denied emergency medical treatment and that the state shall provide appropriate social security to persons who are unable to support themselves and their dependents under Article 43, 1A, 2 and 3. The government also developed a number of policies and established various institutions that seek to promote and protect the sexual and reproductive health rights of Kenyans. As such, Kenya obligated to work toward the fulfillment of this right in line with these international and domestic standards. But in spite of these elaborative measures, violations of the right to sexual and reproductive health continues to be experienced throughout the country. On a report released on 22nd June 2021 by the Center for Reproductive Rights and the Trust for Indigenous Culture and Health (TICA), highlighted the lack of access to sexual reproductive health rights information in Kenya, and it clearly confirmed that reality doesn't match the promise of the Kenyan Constitution, and it showed the disconnection between the promise of the Kenyan Constitution and the reality of women and girls' access to their sexual reproductive health rights. This is why we hosted our medical camp on 22nd and 23rd of February 2024 at Alara Beach and Kitare Health Center in Suba North, Homabay County. As a result of our feedback from our patients who were seen, we have since adopted a unit space at the hospital where we are hosting monthly clinics. Across sub-Saharan African countries, adolescents and women experience structural, health, facility, community, interpersonal and individual level barriers and facilitators to access and utilize SRHR services. In an instance, at the structural level, adolescent girl or woman may encounter barriers to care such as laws and policies that require parental or partner consent. At the health facilities, they also lack dedicated adolescent-friendly and SRHR unit spaces or have staff and providers that stigmatize and discriminate against adolescents and women who show up with such issues. At the community and interpersonal levels, social cultural norms often construct adolescent sexuality as taboo, preventing women and girls from utilizing SRHR services for fear of judgment and discrimination from parents, peers and other community members. And finally, at the individual level, the factors such as self-efficacy, agency, SRHR knowledge and awareness about the availability and type of services offered may all act as barriers or facilitators to SRHR utilization among adolescent girls and women.
Nyinga iluongo ni Christopher Losi, achiel kuom nurses matiyo Kitare Health Center. Watiyo e weche mag konyo mine, e weche mag nyuol, weche mag family planning, weche mag cancer screening. Clinic ma kawuono ni ne watim wakete mondo watim ne jotuo magwa follow up mane waseneno bang'e to gima biro manyien e weche mag cancer screening to kod jok manoyud kod tuoche mamoko. Koro watimo negi follow up mondo wang'e ka gin kod complications moko manyalo konyogi.
Our patients are really appreciative of the support our donors have accorded since the inception of this campaign. and the exclusive model for comprehensive care from the Artistic Bliss and the partners. As a result, we are inviting you to be part of our work dubbed The Journey to Rescue, a docu-series where we'll be bringing to you live our success stories from our beneficiaries. Adopt a patient and save a life. For this is the hope we carry. Thank you.